You're watching CTOM TV. Knowledge is power.
So as I mentioned, if you have diffuse large B-cell lymphoma, then they will give you the platinum drug to determine whether you're eligible for a stem cell transplant. If you fail that, then the previous drugs we just discussed are an option. Otherwise, you could go on to a stem cell transplant. If you are also ineligible, and if they say to you, well, you have diffuse large B-cell therapy or diffuse large B-cell lymphoma, however, you're not healthy enough to get a stem cell transplant, so we're not even going to try the platinum therapy. Then what do? Well, now we know that potentially in those patients, CAR T-cell therapy is a good option. And so for many patients, CAR T-cell therapy is probably going to replace a stem cell transplant. And I think we're going to see more and more of this as we go on. It's like a mini stem cell transplant, but it's like a precision oncology-based stem cell transplant. And so this really is going to be the way to the future, and it's going to replace stem cell transplants. So right now, there are 3 FDA-approved CAR T therapies. They all target CD19 on the tumor cells. And there are 3 approved for diffuse large B-cell lymphoma. So can you go to the next slide, Michelle? So basically, what is a CAR T? In short, what it is you have your blood is drawn from the patients, and they isolate the T cells, and then they modify those T cells. So they get modified receptors and what we call co-stimulatory domains that target tumor antigens are basically introduced into the T cell using a viral vector. And so a viral vector is basically something that this is what we use for cloning in the labs. So what we do is we put the genes we want to have expressed in the cell or part of the new genome into this viral vector. Then we infect those T cells with this virus, and the virus inserts these new genes into the genome of the T cells. And so basically the genes it's adding are modified receptors and co-stimulatory domains that will help the T cells target the tumor cells much better. And so basically, they grow these new T cells, these modified T cells in a petri dish, and then they infuse them back into the patient. So, however, before they give you these new modified CAR T cells, before they infuse them into you, they have to kill off the old T cells that are not working so well for you. So they give you what they call a lymphodepletion chemotherapy. So in other words, you get this chemotherapy that kills all your T cells, and then they inject these new T cells, these new modified, lab modified T cells back into you, and they infuse them back into you. So it's a bit of a process.
Thank you for watching CTOM TV. Subscribe below and stay informed.